Next speaker is Deputy Thomas Bingle. Thomas, 5 minutes.
Thanks, Cathaoirleach, and welcome the opportunity to contribute to the debate today on the health services. I think there are three aspects that have to be addressed at the same time in relation to improving the service for all our citizens. The work in our hospitals, primary care, and in the community hospitals and community care all need to be addressed. Currently, our hospital system works on a 9-to-5 basis with consultants, and that needs to be extended into working on a 24/7 basis, or at least from 8 in the morning till maybe 10 or 11 or 12 o'clock at night, so that diagnostics can be carried out, so that investigations can be carried out, and people can get their X-rays and their CAT scans and everything else at weekends as well as during the week. I think that would go some way to shortening the pressure on the emergency departments and easing the burden there as well. In talking to staff and consultants, particularly in our own local acute hospital in Letterkenny, I was shocked to hear the consultant explain to me that there's currently 3 orthopaedic surgeons now operating in Letterkenny General Hospital, but compared to the 1980s when there was only 1, they are only doing slightly more operations than 1 surgeon did 30 years ago. And that, to me, is a damning indictment. And the reason for that is they don't have access to the theatre space, they don't have access to the theatre staff to enable them to carry out the operations. And under the escalation policy in the emergency departments, very recently, in 5 weeks in a row, the orthopaedic surgeons' elective surgery list was cancelled, even though there was available beds in the orthopaedic ward, but they couldn't be used for emergency department patients because of the risk of cross-contamination and cross-contamination against surgical patients, yet those beds had to lie idle and the elective surgery was cancelled. That doesn't do anything to address the emergency and the crisis in the emergency departments. All it does is lengthens the waiting lists in the hospital. And the staff in Letterkenny believe that by proper use and utilising the theatre space that they have and making it work and work hard, that they could actually, within a year, halve the waiting lists, and within a couple of years, end waiting lists entirely within the hospital. And that should be the goal of any government and any Department of Health, to make sure that that can happen. Within primary care, as Deputy Harty has said, you would need to resource primary care teams, not primary care centres, to make sure that the staff are available and the ancillary staff, like the physiotherapists, occupational therapists and everything else, are available to those GPs so that they can work. And allow GPs to refer directly for diagnostics into the hospital system, rather than having patients going in through the emergency department simply to get diagnosed and to get scans, procedure and carried out. Allow them actually to be referred straight from general practice into the diagnostic system, and allow that to happen. And that would streamline the whole process, remove people from the emergency department, and allow the GPs to actually do the work that they could and should be doing. And that would tie in with the management of chronic illness, like diabetes and as well. So the GPs are integral to managing that process and can consult with the relevant consultants, rather than tying up hospitals with outpatient appointments, so that people can get further investigations. And then, alongside that, what has to be done is to invest in community hospitals and community care for our elderly people, and that is absolutely vital. In my own local community hospital in Killybegs, up 2 weeks ago, there was 5 patients in that hospital who couldn't be released because there was no home care available for them. In fact, one of those patients will be in that hospital a year this June, simply because there's no home care packages available for them. The HSE are desperate trying to recruit people to provide home help and to provide home care, but they can't get them because of the system that has been allowed to generate, where people might get offered a half an hour of work a day over the 5 days, which is absolutely useless to anybody who wants to get involved and actually provide that community care, where they can't recruit because of that system that's there. Who could sign off the dole to take up a job where they work 7 hours a week over 5 days? It just doesn't make any sense. What we need to do is make a career path for people to get involved in community care, so that they can have a reasonable contract that allows them to be there and available for people. And then you can free up those 5 beds in the community hospital, which in turn frees up 5 beds in Letterkenny General Hospital, which in turn frees up the emergency department, and all along starts things moving along smoothly. But the thing about it, and the reason I believe why this doesn't happen, is because that actually costs money. Having those 5 patients move out of Killybegs Community Hospital requires investment to be put in the community care package for them, and that also means that those 5 beds will be taken up straight away. The 5 beds in the acute hospital will be taken up straight away, and there's actually no saving for the Department of Health. And when you want to save money, what do? You allow waiting lists to lengthen, you don't do anything, and that's the only way you can save money in the health services.
Deputy Pringle.